Well, welcome everyone to the Eden Prairie Chamber Candidate Forums. My name is Pat McQueenie. I'm the president of the Eden Prairie Chamber, and I'll be moderator for today's forum. The Eden Prairie Chamber of Commerce is a private nonprofit business association that represents over 325 area businesses and over 34,000 area employees. We want to thank our members for their support and also thank C.H. Robinson, who has sponsored our community events and candidate forums for this year. Today's forum is for State House of Representatives District 48A, and we are pleased to have incumbent Representative Lori Pryor and her challenger Eric Wessels joining us today. Our forum is specifically designed to ask about business issues and policies, and our goal is to allow each candidate the chance to provide detailed answers to the questions to highlight their views and how they would represent Eden Prairie at the state capitol. Joining us with this Zoom forum is Troy Knorr, who serves on the Chamber's Public Policy Committee and Board of Directors. Troy works for Boulevard Wealth Management and will serve as our timekeeper today. Our forum will use the following guidelines. Each candidate has 3 minutes to do an introduction and can highlight issues and topics of their choice. We will then ask our business questions, allowing 2 minutes for each candidate to answer, and we'll rotate who goes first to answer. I may ask a follow-up question to clarify the candidate's response, or if I feel we did not get an answer to the question, we'll have 3 minutes to the question. We will have 3 minutes at the very end for each candidate to provide closing comments. We did flip a coin, and to start our comments today is Representative Pryor. You have 3 minutes for your opening statement.
Great. Well, thank you very much, Pat. Thank you, Troy, for hosting this. I look forward to an interesting discussion today. I thank also all the members of the Eden Prairie Chamber for your involvement and advocacy in our community. You are obviously a group that is just central to our success in this area. So thank you very much for hosting this, as well as the other forums you've done in the past. So a little bit of introduction of myself. Again, my name is Lori Pryor. Representative for Eden Prairie and Minnetonka. We've been in this community for 30 years now. My husband and I moved here actually, he finished a residency in Virginia, and we chose Minnesota as the place to come home to. We're both Minnesotans from our childhood on. And this is where we raised our 3 kids. This is where we have them living and married and our 7 grandkids in the metro area. So we've really been a part of this community for a long time. A little bit about background of my work experience. I had a consulting business. It was in communication, and I was also an adjunct faculty member at Hamline University. As a member of the community, I spent, there's a lot of activities that I did as a volunteer, coaching kids soccer, helping out with girls softball, debate teams, and then I also spent 15 years as a coach for team-based creative problem solving. So the programs were called Odyssey of the Mind and Destination Imagination. So some people in our community just really connect to those because their kids were part of it or they grew up doing it. And it was a great way to help children really develop their skills in thinking, creative problem solving, and also teamwork. So a little bit about that background. In March of 2016, I got a call from somebody, and we were going to have an open seat for state representative, and nobody was coming to run. So they said, "Lori, would you consider running?" And at that moment in time, I said, "What, me?" But they talked to me a little bit more, and what we talked about is that really I had a lot of background for this job. I was a key volunteer with the incumbent, Yvonne Seltzer, and I helped her with her campaign, going door to door, talking to folks, making calls, learning about the issues that were important to people in the area. So with a little bit more of discussion, after talking to my husband, who had told me for years, this is what I should do, I made my first run. So I won that year in 2016. I was reelected in 2018, and I've had the honor of representing you since then. So this is my 3rd reelection, and I hope to continue engaging with voters and really getting to know the topics of this year and what we can do in the legislature. So thank you.
Great, thank you. Candidate Wessels, you have 3 minutes for your opening comments.
Thank you. I would like to also say thank you to the Chamber for allowing the chance for the two candidates, well, the incumbent and myself, to differentiate our ideas and our best pathway forward for the district, and also as our participation for pathways for the state. Myself, I've been an Eden Prairie resident for about 15 years. I've been a small business owner since 1998. I'm a chiropractic physician, and I have had the pleasure of treating many and varied demographic of patients. One of the things that I wanted to highlight was the fact that I made myself unique in the sense that one of the things that made myself unique, I should say, is that I chose to do or pursue chiropractic care beyond just the clinical setting. And one of the things that I always thought was it didn't need to be universal in order to be, or excuse me, it didn't have to be clinical in order to be therapeutic. So I've been doing house calls for about 20 years, and I've had some interesting engagements. That's also given me the freedom to pursue some other things, which includes covering teams as an athletic trainer, both for the public and some of the private schools here in the metro. The thing that had me interested in politics is actually something that was a catalyst that came from our family itself. We've been involved in public service for 3 generations, and I currently have a nephew who is on active duty in Iraq. While the military was never truly an option for me, it was something that I watched the sacrifices that my brother and sister made, and it just shows how important it is that we give back to the community and also give back to the country that has provided us with such fantastic opportunities. So one of the things that also drew my interest to politics was the fact that we have had more and more non-traditional or atypical people enter into the political realm. Businessmen, physicians like myself have gotten into the arena, and I have seen some of the success that they have had, which kind of encouraged me to do the same thing. Considering facing some of the challenges that we have, and some of the things that I wanted to highlight what are important to me are certainly public safety and public health. That being said, there's also avenues that I have learned as a small business owner that I would like to take that acumen that I've learned, maintaining a budget and having employees, employees that I've helped to actually educate for them to also be out on their own. So I've had doctors and a physical therapist that have worked with me, for me, and have now become successful small business owners of their own. And that's information, that's an education I think that I can take to help represent those of us in the district in a fiscal, responsible, and forward-thinking way.
Great, thank you, thank you. Our first question, we'll talk a little bit more about business, and candidate Wessels, you'll go first on this one. Briefly state why you feel you are a pro-business candidate.
I'm a pro-business candidate, first and foremost, because I believe that capitalism combined with free and open trade is the best way forward for both the individual and businesses to both not only survive but thrive. This allows those with the ambition and the entrepreneurial spirit, not to mention creativity, to be successful and to create a product or service that benefits the consumer by competition. And competition is the thing that is going to bring things better to the market. It's going to bring things better that help a service become an expert in its niche, and hopefully that is something that reflects in consumer choice.
Okay, great. Same question for you, Representative Pryor. Briefly state why you feel you are a pro-business candidate.
Great, thank you. So I think I'll have to start with growing up. I'm from Austin, Minnesota, and the business there is Hormel. That's what my dad worked. And in that community, what we saw was that business really was the backbone of the community. Everything was related and spun around Hormel. And then growing up there, what you learn is that business is about more than just short-term profits. Business is about being part of the community and working with your employees to make sure that you're strengthening each other and working together. So I know from that experience growing up, my dad was actually, he was an assistant treasurer there, so he knows the money aspects of it, and he knows, you know, how to keep things sustainable and how to balance a budget. So I think coming from that background, you just learn that, you know, we do it together. It's the community that the business thrives in, and it's the business that helps the community thrive. And that's what I tried to bring to the legislature, is that understanding.
Okay, great, great. Next question, still related to business, and Representative Pryor, you'll go first on this one. COVID-19 has greatly impacted our businesses over the past 6+ months. Do you support having the governor manage this through executive order, or should individual businesses decide if and how to open? And at what point should businesses be allowed to decide how to be open in a way that is safe to their employees and customers?
Okay, and that is the great question of the day. So to put a little context, Minnesota is one of the other 49 states that do have these executive emergency orders in place. So basically all the states in the country except for Wisconsin, which has reinstated certain aspects of the emergency orders, are working under the same condition, which is that we look for the governors and the executive branch for leaderships on how to fight this pandemic. And what they're trying to do is process the information that we have coming towards us so that we don't ask every business to be a public health expert, but that we ask the public health experts to give us the best information possible for fighting this pandemic. So I do believe that what the governor is doing and what he is continuing to do, which is to have the lightest touch possible so that we can survive this pandemic, because we can't choose between the economy and public health. We can't have an economy if we don't have public health. So right now we're focusing on the mask mandate, and the CDC right now is saying basically wearing a mask out in public and in situations where you're going to be close to people that are not in your bubble, you know, that expression that we have right now, it's like a vaccine. So just to get out there with that information and then watch the data. And if we can bring down those cases, then we can lift more and more restrictions. Right now, most of the economy is open. And it's just some situations that are particularly dangerous for spread that we have to keep watching and keep a lid on so that we don't go into exponential spread of the disease as we saw in some other states.
Okay, thank you. Candidate Wessel, same question to you. COVID-19 has greatly impacted our businesses over the past 6+ months. Do you support having the governor manage this through executive order, or should individual businesses decide if and how to open? And at what point should business be allowed to decide how to be open in a way that is safe to their employees and customers?
First and foremost, if we're talking about businesses large and small, people that are in the business sphere are the experts there. The experts in the workplace and their workspace are going to have the best ideas how to move forward in a safe and effective manner. Businesses also are looking for certainty. And because we're having things as preposterous as you have to walk into a restaurant, but then you can take off your mask, does not seem consistent when it comes to how to run a business and keep people safe. Business owners are looking for an avenue where they can be open. They will also follow rules if they are set forth in a realistic manner. Putting those restrictions on a company at least gives them then the parameters at which they can work and succeed by still encouraging participation by their patrons, who they have no interest in making those people unsafe or even uncomfortable in their workplace. They would like to see success. They would like to see certainty. And the fact that we are still enduring the mask mandate, when again, we're talking about a virus that's measured in the size of nanometers or microns. There isn't a mask on the planet which stops a virus. That being said, honoring the requests of the CDC, which again are moving the goalposts almost constantly, to give people enough comfort If it's the social distancing aspect and or the mask, I would leave that absolutely up to the individual. If you want to come in with a mask because you're uncomfortable, by all means do so. If you're comfortable conducting business and conducting your personal life without the mask, again, I think that should be up to the individual.
Okay, great. We're going to move to tax and fiscal policy, and candidate Wessels, I'll have you answer the question first. Minnesota is viewed as a high tax state and typically is listed in the top 5 for highest taxed. What is your position on the current Minnesota income tax? We have a top rate of 9.85% and then corporate tax rates in addition. Are current rates too high? Are current rates equitable and should stay the same? Our current rates should be raised so that state spending can increase to support more public services. And why do you feel that way?
Government policy, when it ever comes across a good or a service, its idea, if it wants less of it, is always to increase the taxes on it. Just the opposite could say if you wanted to promote it. Higher corporate tax rates and higher personal income tax rates have done nothing but stagnate growth and, not to mention, retard startups, along with other regulations that are there. Our taxes are too high. We don't have a tax problem. We don't have a revenue problem in Minnesota. We have a spending problem. And that means better allocation, getting by on less, because that's what the government has not done in the past. The taxes, lower taxes, are always an incentive for greater business growth and expansion. And those are the things that should lead not only our district, but Minnesota back to the health that it had prior to COVID-19.
Okay, great. Representative Pryor, same question. Minnesota is viewed as a high tax state and typically is listed in the top 5 for highest taxed. What is your position on the current Minnesota income tax? We have a top rate of 9.85% and corporate tax rates on top of that. Is the position current rates are too high? Current rates are equitable and should stay the same? Current rates should be raised so state spending can increase to support more public services? And why do you feel this way?
Well, my answer is, and I do look at the nonpartisan groups that study Minnesota taxes and compare it to tax rates and ways of taxations with other states in the US. And what they have told me, these nonpartisan groups, is that Minnesota does use progressive taxation. And in fact, is probably of all the states is one of the best at doing this. So I think the way that we tax is a fair way of taxing because we do use progressive taxation. So I will, I think that that part should stay, and I do support that. I also would say that right now we're known as maybe as a high tax, but we're also known as a high service. And again, they've done studies where they say, well, why would you locate to a state? And a lot of employers, what they're looking at is, what's the workforce in that state? And what they see in Minnesota is a state that has a strong workforce, an educated workforce, a workforce that's ready for the jobs that they have to offer. So we can't divorce our education systems, our workforce development systems from our taxation system and say that we can have a strong economy. So I think that Minnesota is working on the right balance going forward. We had a strong economy before COVID. We're actually doing better under COVID than many other states are right now. And I think we need to hold the line on that and keep moving forward carefully.
Okay, thank you. Next question, and this will go to you, Representative Pryor, first. Sticking a little bit with tax and fiscal policy, with the budget shortfall projected, how would you plan to balance the budget, and in what areas would you look to cut spending?
Right. So when we come back into session in January, it's going to be a budget year, and that's going to be something that's going to consume all of us. I would say that we're going to look at cuts in every part of the budget. And that's just the nature of it. Right now, education and human services are they have the biggest pieces of the pie in the Minnesota budget. And those are going to be extraordinarily difficult areas to look at cuts at because there was areas within those that were struggling before. I do serve on the education committee. I know that the federal government has been shortchanging all states in special education. They're not keeping up with their promise to fund special education, and local school districts in the states have been having to make up that budget shortfall that the federal government is handing us. And so it's going to be tough. It's going to be tough to bring this budget back into balance. And so we're hoping that our federal partners come through and they don't leave us behind when we go into budgeting in the next session.
Okay. Candidate Wessel, same question for you, and that is, with the budget shortfall projected, how would you plan to balance the budget, and in what areas would you look to cut spending?
First and foremost, I would have liked to have said that we could put a pay freeze in place for the state's largest employer, that being the government, but since that's off the table, we won't do that. I would also like to say that unlike my opponent, in this particular situation, I wouldn't look at anything like a tax increase, because a tax decrease, again, as I said before, tax decreases can be the spur and the catalyst for a greater expansion and a return to the normal of what business was operating at prior. This opens the spigot for collective tax, increase in tax collection and revenue back to the state. In addition to that, what needs to happen is an audit, again, of the two largest parts of our budget, being education and human health services. Because they are so large, I think an in-depth look at that to make sure that we understand and get the expectation of investment that we put into it. So the reason is because they get so much money, we want to make sure that we are getting a positive investment for the money that is actually put into those projects. Beyond that, cuts across the board of 1% to each one of the departments, I think, is realistic. This government, this particular administration, this particular leader has mandated unrealistic expectations and closures to businesses large and small in the metro and outstate. That being said, the public sector needs to take a bite of the same apple and get by on less for the next budget biennium.
Great, thank you. Next question, and we're staying in on policy here, and Candidate Wessels, I'll have you go first with this one. Businesses have concerns on local municipalities having their own ordinances on business that are different than the state's. This started with Minneapolis as a good example of mandating benefits and minimum wage within the city of Minneapolis. In essence, these cities doing so develop a patchwork across Minnesota of different rules and guidelines based on what a local city or county may put in place. Do you support legislation that would prohibit local governments from mandating what private sector employers pay in wages and benefits, and have these rules be determined at the state level? And why or why not?
I don't support the government mandating minimum wages, because again, that has a great effect on what the open market can do. If you have a skilled workforce, you have the employer and the employee creating a negotiation for a benefit package that benefits them both. If this is a talented individual that is going to help a company succeed, they have the opportunity to negotiate their best way forward. Mandating minimum payments or minimum wages, is all that's going to do to decrease the amount of jobs in the public in the workspace, because if you mandate certain costs, and payroll being one of the higher ones, when you mandate a minimum wage for people, you cut into what can be already a small margin for things like restaurants and bars. If you mandate a certain wage that cuts into that margin of success, you decrease the potential for increase in hiring and business expansion, because payroll being already a vast majority of what people have for overhead, if you increase and mandate a certain cost, it's going to limit the amount of employees that you can have. That has a double-edged effect. Companies can't further expand, and people cannot keep or maintain jobs, or get or maintain jobs,
Okay. Thank you. Representative Pryor, same question. Businesses have concerns on local municipalities having their own ordinances on businesses that are different than the state's, which started Minneapolis with their ordinance regarding benefits on business, as well as an increase in the minimum wage. In essence, these are developing a patchwork across Minnesota, different rules and guidelines based on what a local city or county would put in place. Do you support legislation that would prohibit local governments from mandating what private sector employers pay in wages and benefits, and have these rules be determined at a state level? Why or why not? And you have 2 minutes.
All right, thank you. So actually, this issue does go back to my first term in 2016 and 2017, and that's when Minneapolis and St. Paul put into effect these ordinances. And one of them was 2 weeks of sick leave, which, you know, right now, I think a lot of people in the states wish their local cities had those, that ordinance in place, because it means that if somebody feels sick, if somebody's coughing, if somebody's having a fever, they know that they don't have to choose between getting a paycheck and staying home because they're ill. And if you work in a restaurant and if you're coughing on people's food or coughing in the air, that's a public health problem. And with the pandemic right now, that is an issue that people across the state are concerned about as consumers. So it is, but it is something that Minneapolis and St. Paul passed. I did not vote in favor of preemption of not allowing them to make that law. It seems that in the US and Minnesota at times, you know, that the state level, we've been dealing with a lot of gridlock, and that issues that people want to see passed and move forward get stuck in this partisan fight. And it's always about not governing, but it's about winning the next election. And what you see is cities, Minneapolis, St. Paul, other cities in the country that are taking the initiative and trying out public policy that they think benefits their citizens, and they're winning elections doing it. So I did win re-election after I took that vote in preemption. And when I talked to my voters, it was something that they saw as a good vote for Minnesota.
All right. We're going to move our topic to transportation, and Representative Pryor, this question goes to you first. A good transportation system is key to businesses in terms of moving goods and having employees able to get to work. Do you support dedicating general funds to transportation needs as a top priority? Why or why not? And then do you also support an increase in the gas tax?
Well, yes, I support an increase in the gas tax, and that's a vote that I took. What you see in our Constitution is that we're supposed to have a user-funded transportation system, and right now it's the gas tax that we're trying to use to fund our transportation system. But we haven't raised that, and we're not keeping up with inflation. And so what's happened is the money that we need to support our transportation system, which, yes, is critical to our economy, it's not there. And so what's been happening is that more and more money has been siphoned off of education, of health and human services. People with disabilities are being stretched. Their programs are being stretched and being tapped because we're not keeping up with our fees, the user fee of the gas tax that was set up to and created to support our transportation system. So I think that we need to keep pace with inflation. We need to start raising that gas tax so that we can keep maintaining this critical infrastructure in the state.
And just a quick follow-up to that, would you be inclined to use general funds towards transportation needs as a top priority?
You know, any budget, there's going to be give and takes in any budget year. So I would never preclude taking that general funds, but I would not pass legislation that said that we would continually dedicate more funds at this point. So it's something that we would have to look at in every budget year.
Okay. Candidate Wessel, same question for you. A good transportation system is key to businesses in terms of moving goods and having employees able to get to work. Do you support dedicating general funds to transportation needs as a top priority? Why or why not? And do you support an increase in the gas tax?
Representative Pryor mentioned that we need to maintain a rate of taxation that's equal to inflation. We have not had an increase in inflation in quite some time. And if that's the equation, then we should not raise the gas tax, and we should continue to use it in a prudent manner and use it in a specific manner to maintain the infrastructure. Any increase to the gas tax is felt all the way down that economic line, from delivering of goods, from the cost of transportation, and as far as the general fund, the general fund seems like that it potentially is a morass that can be pulled from without itemization. I would just like to know that if we are taking from the general fund and not at the expense of other programs, let's make sure that it can be something that either does not offset something like education, or more specifically public safety and law enforcement, that it could be used prudently. But again, these are taxes, and these are numbers that should be visited frequently to make sure that we are making best use of the gas tax so that we can maintain the infrastructure. In addition to that, if we're looking at true use of gas tax and true use of infrastructure, some of the things that we have done as far as trying to build this train and increasing infrastructure that is being unused and that is not paying for itself and is constantly having to be subsidized, not to mention the cost of it being 60% to 70% higher than the use of buses, I think that is not a good use of transportation money, and we can do it better.
Okay, thank you. Going to shift topics to healthcare. And this question will go to you, Candidate Wessels first. Minnesota mandates coverage of roughly 60 benefits as part of fully insured individual and group health insurance products sold in the state, putting Minnesota in the top 5 states with the most mandates. Do you support reducing the level of mandated insurance benefits to reduce the cost of health insurance for businesses and their employees? And what additional policies would you support to lower costs for health insurance in Minnesota?
I would encourage the reduction of these mandated benefits just because you don't have an individual plan. When you have these mandates, there's no such thing as a personalized plan that allows the individual to, cafeteria style, pick and choose things that directly apply to those persons' individual needs. In addition to that, one of the best things that you can hope for with any good or product with regards to increasing quality and decreasing cost of the consumer would be open the market. Open the market to Minnesota so that it competes with 50 other states' insurance plans. This again creates competition among the market. And the best thing that it can do for both large employers that have to buy large plans and also individuals like myself who have small businesses, it allows us to constantly check and make sure that we are finding the best and most personalized plan that helps us in our demographic of age and our demographic of gender, while then allowing us to also shop for the best premium to fit our budget.
Okay, great, thank you. Representative Pryor, same question. Minnesota mandates coverage of roughly 60 benefits as part of a fully insured individual and group health insurance products sold in the state of Minnesota, putting us in the top 5 states with the most mandates. Do you support reducing the level of mandated insurance benefits to reduce the cost of health insurance for businesses and their employees? And then what policies do you support to lower costs for health insurance in Minnesota?
Right, well, this is, it's a great question, and we could probably spend the entire 45 minutes talking about healthcare and the way to bring down cost and maintain quality. I think the way the question is phrased, I don't think the best thing to do is to look at those mandates to bring down cost. I think that would be just very incremental, and also that the consumers, employees of businesses, but just basically us, those are helping us to make sure that we're getting the full coverage that we need, so that if we are ill, if we need health care, that we don't go broke getting it. And that's what I hear more from voters or from my constituents, is they really care about the coverage and they want to make sure it's complete. I think that a better way to look at this is something that I've been hearing about for a long time, mainly from my husband. You know, we are products of, and not just the work that we do, but the people around us. And he's a physician, and he has gone on, and he's an executive at a healthcare system. Mostly a rural system right now is the one where he's the president. But what he's looking at and what he's talking about insurers with is something that we just saw in the paper that Blue Cross and Blue Shields are working on with the lineup. And this is called, as an idea, it's value-based medicine. So instead of using this system and this model, which is, you know, the physician does a procedure and that gets a fee, but it's value-based, and it's really what quality, you know, how do you, it's finding a way of measuring and rewarding value, which is health. And you can do it through coordinated service, telehealth, and quality measures. So it's a new model, and I think that's where we're actually going to bring down costs and actually promote quality. And in other words, health behind healthcare.
Okay, thank you. I'm going to ask one final question, and we'll go to closing statements here. On education and workforce, and Candidate Wessels, we'll start with you on this one. What policies do you support to help Minnesota companies meet their workforce needs now and in the future?
I think that we need to incentivize the pursuit of education in the trades. I think we also need to incentivize companies to hire local. I think we can do that with tax benefits and other things to make sure that we pull from a local low and mid-skilled labor. I think another thing that we can do is do a good job effectively using employees that are on the H-1B visas. Like Representative Pryor said, we have a very educated workforce here, and we do have a large number of medical technology and finance, and it would be great if we could fill those positions with some of our college graduates here, rather than turning to some of these H-1B visa participants. I'm not saying they're bad people. I'm saying they're probably great people and they're qualified for the job. It would just be great if we could incentivize to hire local, to hire Minnesotans. And again, when companies have exhausted that pool, either be it in labor or be it in professional degrees, then at that point, dipping into some of those other pools of candidates, I think is absolutely realistic.
Okay, thank you. Representative Pryor, same question. What policies do you support to help Minnesota companies meet their workforce needs now and in the future?
All right, so thank you for that question. One of the committees that I serve on is the post-secondary higher ed committee in the House. And we've spent many committee meetings talking to businesses about their workforce needs. We actually set up a scholarship for, it's the 2-year community colleges, and we were giving extra scholarship aid to students that wanted to get degree programs in the highest need occupation areas. So it was welding, and it was nursing assistants, and there was a longer list of critical needs in the state for trained employees. And so that's one policy that we put in place, and it was actually, that was my legislation that we enacted, and I'm very proud to be the author of that in the House. But it's going to go beyond that. And I think especially now with this people that we have with the pandemic and the levels of unemployment that we have right now, a lot of it's going to be retraining and making it easy for adults to get back into some kind of program that helps them retool and get ready for their next job. And I think this will be that time in history where there's some industries that just are not going to come back the way they were before, and that's okay. We're going to let them go. But that we're going to need to embrace and be ready for the next the next boom in our economy, and that we're going to need employees that have the education that matches the needs of the employers and of their future careers. And so our post-secondary education system, let's make sure that people have access to it and use it in a way that builds our economy.
Okay, great. Well, we'll move to closing comments, and Candidate Wessels, you'll go first. You have up to 3 minutes for closing comments.
Okay. First of all, let me address the fact that Representative Pryor just mentioned that we have businesses that are going to be going away. Up until COVID-19, we had record unemployment and we had great surpluses here in the state of Minnesota. To say that we have businesses that are going away because of the virus, I think is preposterous and negative and endorsing what's called the new normal, which I reject with 100% certainty. There's no such thing that we need to resort to something called the new normal when we can return to the strength of the economy that we had prior to the infection. That being said, what we need to restore is the two-party system, which I think is the greatest way forward for good policy. We currently have a standoff between one party and one individual, and it's only through robust and spirited debate and finally compromise that we can actually move policy forward. And that policy forward that helps the most Minnesotans is going to be in the arenas of public health, public safety, and most importantly, the economy. Thank you.
Thank you. Representative Pryor, you have up to 3 minutes for your closing comments.
Well, thank you. And I'll start by saying that what we're finding now is issues that we were having before the pandemic were really laid bare and fully exposed during the pandemic. So, the changes that we are seeing in our education systems and our economy, and our health systems, really are being accelerated because the pandemic is helping us be aware of what's really essential and what we need to pay attention to. And I can give an example and again, this was something that was in the paper, but it was something that I've been talking about and been aware of long before that, which is telehealth. Now, before there was a lot of reluctance to use telehealth for different applications because, it was new, it was different. And some of it had to be cleared away by the legislature to say, well, yes, if you're on the phone with someone, if you're on a teleconference with someone, you can actually charge for that the way that you do in an in-office business. So there was some legislative change that enabled telehealth to really take off. And one area where it's really working is in mental health services. And people are finding that if they need to talk to a counselor, if they need to talk to their psychiatrist, if there's issues in their life and stress in their life, they don't have to make that drive, but they can actually do it from home. And so what happened is this part of delivering healthcare is being accelerated, and we're not going to go back, is what people are saying right now. Both the person receiving the care and the care provider for certain applications says, yes, this is working. I'm glad that we tried it. And we realize now this change that we were reluctant to embrace is helping us to be better healthcare professionals. So yes, there's going to be changes. And it's just, there are disruptive events in a person's life, in the life of the state, in this country, and in this world. And we can't say, well, it'll all go back to just the way it was before it happened. But what we have to do is we have to be ready. We have to be paying attention. We have to say, this is what was lost, and we can't afford to lose it. We have to get it back. But we also have to say, this is what was changed. And some things we're going to have to let go, but we can come back. And Minnesota, I have full confidence, is going to lead the nation in the comeback after COVID-19. And I want to be on board, and I want to make sure that happens. So I hope that I can earn the vote of many of you that are watching today. Thanks.
All right. Well, thank you both for your participation today, plus stepping forward and putting your name out there on the ballot. We know it's not an easy thing to run for elected office, but we do thank you and wish you best of luck in the upcoming election. As always, we encourage people to research and evaluate the individuals running, find the candidate that best represents their viewpoints, and get out and vote. That's the big thing coming up between now and our November election date. So again, thank you both for your time, and we wish everyone a great day.